Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boyington.
Welcome to our special Local Spotlight segment on National Recovery Month, observed every September to promote and support new evidence-based treatment and recovery practices, the emergence of a strong and proud recovery community, and the dedication of service providers and communities who make drug and alcohol recovery in all its forms possible. Today, we're focusing on a critical aspect of recovery, the relationship between mental health and addiction, also known as co-occurring disorders. These intertwined conditions pose unique challenges, but also offer opportunities for recovery. Joining us to shed light on this important topic is Dr. Dan Neff from Miramont Treatment Center, part of Mainline Health. Dr. Neff specializes in mental health and addiction and will help us understand the intricate connections between these disorders. Dr. Neff, thank you so much for being here with us today.
Thank you. Glad to be here.
All right. Can you explain the connections between mental health disorders and addiction? How do they influence one another?
It's helpful to remember that at their core, both of these represent processes occurring in the brain. It's not a coincidence that we talk about addiction as a chronic brain disease, as we always have with mental health. Because both disorders are happening in the same organ, it's not surprising that their symptoms can not only overlap, but affect each other.
In your experience, mental health issues typically precede addiction, or is it more common for addiction to lead to mental health problems?
This is a great question. I see both on a daily basis. We all experience our own emotional challenges and pains. When we turn to substances, whether for recreation or to try to manage our feelings, we're inviting in a new challenge. Many young people are unaware how dangerous it is for your mental health. I often tell them, whatever the drug does for you in the moment, it takes back more from your baseline.
What are the main challenges in diagnosing and treating patients who suffer from both mental health disorders and addiction?
We focus on treating the whole person, whether they walk in the door focused on mental health symptoms or addiction. For instance, a patient who recently came to the office for alcohol use had pretty significant untreated ADHD. He or she could not even engage in learning the coping skills we were trying to teach until that was properly treated. As long as active substance use is present in treatment, it makes it harder not only for a person's illness, but harder for us to identify the correct treatment.
Can you describe some effective treatments for managing both mental health issues and addiction simultaneously?
We know from decades of experience that people do best when they are part of a community, and in the case of addiction, a sober community. Other people in recovery can be helpful to each other in ways that professionals just can't. In therapy, we focus on healthy coping skills for mental health challenges, relapse prevention for substance use, and everything in between. Finally, we don't forget the importance of appropriate medication to quiet those symptoms down. These symptoms can be anything from drug craving to depression or anxiety, or PTSD flashbacks and nightmares.
So what preventative measures can be taken to address mental health issues early on to potentially prevent the development of addiction or vice versa?
Access to care remains an ongoing struggle. Unfortunately, mental health has taken a backseat to physical health in our society for a long time. Addiction is a brain disease that can be treated, not an unsolvable moral failing. We need a lot more education. So many people are unaware about the risks of leaving mental health untreated and the dangers of the substances they use. Routine screening in schools and workplaces is helpful, as is the engagement of the entire community.
If you could offer some advice to someone watching this that could be struggling themselves with mental health or addiction, or if they know a loved one that's doing the same, what would that advice be?
If you're struggling with a mental health challenge, I encourage you to be kind to yourself and ask for help. Sometimes it's the hardest step in getting better, but really accepting that there is help out there for you and that you're not the only one who's gone through this before. When it comes to addiction, I encourage you to discard any shame that's holding you back. And I'd encourage you to really seek out the help that might actually help you get better and that we see help people day in and day out. We believe you deserve it, and we would like you to believe that too.
Whether or not it's you struggling personally, you probably know someone in your life who has been struggling as well. So thank you so much for being here with us.
You're welcome.
All right, so to learn more, visit mainlinehealth.org/WellAheadPhilly. Thanks so much for watching and have a great rest of your week.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.